Okay, you ready? Bring up certain health topics, and most of us get a little uncomfortable. Colorectal cancer is certainly one of those, but the truth is, it's the third leading cause of cancer-related deaths in adults in this country. So it's time to start talking, and this Saturday, lots of people are going to be doing a lot more than talking. This is what we're looking at right now. We are looking at the preparation involved for a colonoscopy. If you are 50 years of age or older, listen to this next guest. I'm just going to tell you, it may be the third most common cancer in this country, but it's also one of the most preventables. Doctor, great to have you here.
It's my pleasure. I always like to come and to see you, Jed.
You are one of many doctors at University Surgical Associates, but let me just say, I have known you for years. I think you are a true bright spot in this medical community because, you know what? I mean, you are a colorectal surgeon, a tough topic, but you know what? You make it so understandable for people.
Well, we sure hope so, because it's very important. You own your body. We got to take good care of the body. And one of the things we ought to do is we want to stay on our screening. So a lot of women know that you should have your mammogram. Many men know about the prostate. They should have their prostate checked. Well, both men and women should have their colonoscopy beginning at the age of 50.
Let me just say, it was no problem at all. I mean, I made my wife go, and it was really no problem. It was an easy for me. That was the best sleep you've ever had. But I think the worst part about the colonoscopy, it's like running a marathon, is to ask people about their experience. You don't do that. That's the worst part.
It's a little taboo.
Right. But everybody has heart. It's like, it wasn't bad.
Correct. But it's something that when we all get to the age of 50, we should all have in common. And what's so sad is here in the South, particularly in Chattanooga, we are in the lowest quartile. We are in the bottom 25% of the entire United States in terms of getting our colonoscopy. And what that means is if you don't get your colonoscopy, you will eventually have a colon cancer. Okay? And so we're trying to save folks that trouble. As you mentioned, it's not that hard to have the colonoscopy. The first thing, though, is you need to know it's got to be done. The second thing is you need to know, who do I ask about getting my colonoscopy? So you want to talk to your primary care doctor. They will point you in the right direction. Folks who do colonoscopy would be a gastroenterologist or a colorectal surgeon. And in some parts, some of our general surgeons, some of our family practice doctors can do it too.
I'm going to have to ask you this question.
Okay.
Why colorectal surgeon? How did you get into that?
Do you really want to know?
Well, I mean, come on. I mean, everybody's going to ask you that. You hear all the time, but why that part of the body?
Well, I didn't go to medical school with that particular goal. I went to medical school knowing that I wanted to be a surgeon, because when I was in 3rd grade, when we had show and tell, people brought their daddies to work, and my neighbor was an ophthalmologist, and her daddy brought cow's eyes. And that day I came home from school and I said, I want to be a surgeon. But I went to medical school and I said, I'm here to be a surgeon. I didn't realize I needed to pick a type of surgery. And so I looked at all the different types of surgery, and I liked all of them, but I really liked colorectal surgery because I wanted to be a happy doctor. And colorectal surgeons are happy for 2 reasons. One, we have a pretty good sense of humor. And number 2, our patients tend to be very happy because we can make an impact. And my idea as a surgeon is I want to fix something, and then I want you to go on and live your life happy.
Man, I think you are unbelievable. All right, let's talk about the Rump Run that's coming up.
Yes, this Saturday.
I mean, come on. If you're going to run any race in town, wear a T-shirt that says the Rump Run. It is going to be an incredible day on this Saturday. It's going to be at the Enterprise South. It's a beautiful course, and you know what? You're talking about people who have a sense of humor. Some of these names for these teams,
yes,
it's so enjoyable.
And we have prizes for the best names. In fact, that's half the fun of it. It is a 5K timed run, and then we have a 1-mile walk. And the walk is almost like a parade where you get a chance to really see everybody's T-shirts. And they might be sponsoring, for example, a survivor, you know, someone's mother, father, and they come up with the best name. So we do have good prizes for that.
And let me just say, all the money stays here to benefit the Chattanooga Foundation. Is that right?
Correct. And so what we do with that money is 2 things. Our mission is, one, to educate folks so they know they need to get that colonoscopy. And so you've been part of our billboard campaign, and we'll be seeing you on billboards next month.
That's great.
Telling everybody to get their colonoscopy, so we thank you for that. And number two, we want to be able to raise enough money to pay for colonoscopy for folks who do know they need it, but they don't necessarily have insurance to pay for that. And with our local medical society and help from our gastroenterologists and surgeons, we're going to be able to do that this year.
Does it really affect, I mean, if you're eating, does it really affect colorectal cancer, or is it just going to be genetics here? I mean, is our lifestyle, or is it going to be genetics?
Well, I will say it is a combination of all those things. 75% of the time, it has nothing to do with genetics. So most people are what's called sporadic. That means it's that one person and they didn't have it in their family. And that means only about 20 to 30% of people have some kind of genetic mutation that's going to lead to cancer. Okay, but we do have tests now that once we identify the first person in a family who has that cancer, we can test either their tumor or their blood and see if they have the genes for colon cancer. And then we can test everybody in their family so they know whether they need to have colonoscopy more frequently to catch those polyps.
I always ask you this question. It's 2015. We've known each other for several years.
Yes.
So what is the technology doing to change colorectal?
Well, I would say in colon surgery, now we use the robot. The robot's been available for probably 10 years, but it's used mostly for gynecologic surgery and prostate surgery. But now there are some attachments to the robot that allows us to use it for colon surgery. And I remember when I started surgery, people would stay in the hospital 5 to 7 days because of a big incision. With the robot, they can go home in as little as 2 days. That's a big difference. But the part that I personally think is the most exciting is now we have the capability to do gene sequencing. So for example, if one person has a type of tumor, we can actually test the tumor and decide what kind of chemotherapy medicine is going to work best for that tumor, instead of having to do trial and error where we have to try a bunch of different medicines to finally find the one that works best.
And one of the most important things you've always said, it is curable if it's caught early.
Yes.
Get the colonoscopy. Okay, I'm 54. I had one 2 years ago. When's my next one?
Now I'm going to ask, did you have polyps or didn't have polyps? Do you remember?
I think there was a polyp, but it wasn't. I mean, I think it was just, he says it's natural what was in me.
Okay. I will say there are many different types of polyps. Most polyps, we think, will eventually turn into colon cancer. And for that reason, if you have cancer in your family, if you've had polyps yourself, you get to have a colonoscopy every 5 years.
Okay, I didn't enjoy it that much, but
we've known each other 5 years now.
Okay, but I did have it. All right, here it is, the Rump Run. Let's talk about this. Come on out there. March the 21st, beginning at 9 in the morning. Actually, registration starts at 7:30. The atmosphere is so much fun out there. I have done this before. Enterprise South Nature Park. You should go to the website and see it. Rumprun.com. Rumprun.com. It is March 21st. It is this Saturday. David says the weather is going to be great. And most importantly, when you cross that finish line, you're going to be hearing clapping from all survivors. It's a great event. Thank you. And thank you for University Surgical Associates for what you do in this community. It's great to have you here.
Oh, thank you. Anytime. And I appreciate your commitment.
We're back.